Great. Good evening, and welcome to Adult Children of Aging Parents, or ACAP. My name is Ashlyn Martin, and I, along with Bruce McReynolds, serve as co-chapter coordinators of ACAP Guilford County. On behalf of the ACAP Guilford County leadership team, we would like to welcome you to tonight's presentation entitled Supporting a Loved One After Hospitalization. ACAP Guilford County programs are presented the third Thursday of each month at 7 p.m. You can visit the upcoming events section of the ACAP community website at acapcommunity.org to view the presentations. We hope that you will join us for our upcoming programs. The topic for our April program will be Strategies for Effectively Managing Medications, and the program will be held on Thursday, April 21st. Be sure to subscribe to the ACAP Community YouTube channel and click the bell notification icon to be alerted of future videos. If you would like to be notified of upcoming programs, you can also join our email list by emailing us at acapguilfordcounty@gmail.com to get on our mailing list. We invite you to visit the ACAP Community website for information on upcoming programs from all of the ACAP chapters. And you can also take advantage of expert-led content in our podcast library found on acapcommunity.org. In order to bring our programming to you at no cost, we have some really great organizations that have stepped up to sponsor our activities and monthly programs. In Guilford County, our annual sponsors that make all of our chapter activities possible include four core sponsors: Griswold Home Care, Health Team Advantage, Providence Place, and Booth Harrington and Johns. And we would like to thank each of those sponsors. I would also like to introduce our program sponsor for tonight's event, Senior Resources of Guilford. The mission of Senior Resources of Guilford is to serve our diverse community of seniors and their families by advocating and providing supportive services that enhance the independence, health, and quality of life for seniors. For over 40 years, Senior Resources has been providing a variety of services to help older adults and their caregivers throughout Guilford County. Services include Meals on Wheels, community nutrition, restaurant voucher program, a senior line information and referral program, Senior Wheels, the foster grandparent program, the Seniors Health Insurance Information Program, family caregiver support, the Evergreens Lifestyle Center, rural outreach, refugee outreach, and options counseling, and much more. Volunteer opportunities are also available for individuals wishing to serve the community through the Meals on Wheels and Senior Wheels programs. For more information, we invite you to call Senior Line at 336-333-6981, where you can be connected to not only the agency services provided by Senior Resources of Guilford, but other resources and supportive services throughout the county. So thank you to Senior Resources for sponsoring tonight's event. So let's jump right into tonight's program. It is an honor and a privilege to welcome our speaker, Carroll Spinks. And she will be presenting on supporting a loved one after hospitalization. Carroll has been a registered nurse for 37 years and a geriatric nurse practitioner for 24 years. She has been a care manager for 23 years, specializing in the care of older adults. Her work is focused on chronic disease management, patient advocacy, patient education, and to a great degree, helping her patients avoid disease complications and hospital readmissions. Carroll received the honor of being a Great 100 Nurse of North Carolina in 2017 and received the Cone Health Nurse Excellence Award in 2021. She is a member of the Gerontological Advanced Practice Nurse Association and a past Carolinas chapter of GAPNA president. So tonight we would like to welcome Carroll, and at this time, Carroll, we will turn it over to you for your presentation.
Thank you very much, Ashlyn. I am really happy that you're there to have my back this evening. Welcome, everyone, and happy St. Patrick's Day. I'd like to thank Lisa Guy for inviting me to provide this information tonight, and Bruce McReynolds, who has really been a great IT fella to set me up this evening. First slide, please, Ashlyn. Can you see the homecoming?
Oh, just a second.
Okay, and next slide. There we go. So tonight's presentation is homecoming, supporting a loved one after hospitalization. This is right down my alley. As you heard in the introduction, it's something that I've been doing for a long time, and I hope that I can shed some light on this important issue. Next slide, please. I'm going to, oops, if we could go back one, please. The objectives for this evening are to learn what to do to prepare yourself or a loved one in anticipation of having to go to the hospital, learning what to do while your loved one is in the hospital, learn how to prepare for the homecoming after hospitalization, and learn what we can do to prevent other hospitalizations. And next slide, please. Before the emergency happens, being prepared is the key. As you can see, Benjamin Franklin had a very nice quote here: an ounce of prevention is worth a pound of cure. We all have to be really good. If you would please go back to the previous slide. We all really have to be good scouts in life. We prepare for almost all phases in life. We prepare like where we're going to go to school, what we're going to study, who we're going to marry or have a relationship with, when we're going to have kids, if we're going to have kids. But the one thing we don't plan on very much is the worst case scenario. So this is something I really want to spend a little bit of time on. It's one of my great passions in my work. And then we'll get to the real subject of after the hospitalization. So next slide, please. Being prepared. So this is a checklist for everybody. So myself, for your mother, father, your neighbor, maybe even your adult children. And we want to be prepared. So the first thing we can do is to keep an up-to-date medication list and allergies in our wallet or our pocketbook. If you have a medical condition such as diabetes, you need to wear an emergency alert, either a necklace or a bracelet. It's very important to complete a healthcare power of attorney, and this can be done without a lawyer. The only thing is your signature has to be notarized, and that needs to be with your doctor in the hospital record and with whomever you choose to speak for you if you cannot speak for yourself. And that person needs to be somebody that you trust with your life, because if you can't speak for yourself, they're going to be the ones making the decisions. I want everybody to also think about what they would or would not want to happen in that worst case scenario. You need to talk with your family about what your feelings are and what those things that you want are. I have with me a copy of the Healthcare Power of Attorney and Living Will. The Healthcare Power of Attorney appoints a person to speak for you. The Living Will says under certain situations you would or would not want certain medical interventions. Another thing that's important to have, especially if you have a situation where you may not want to have absolutely every medical intervention performed. And that is, one of the forms is a MOST form. It's a bright pink form. You can fill it out. It basically tells you in a nutshell everything we've already talked about, advanced directives, who's to speak for you, what you want, and it's bright pink so the emergency squad can see it when they come in the home and know what you want. It's very important because if you do not want CPR, this form needs to be in the home. The emergency squad is tasked to do everything they can to preserve life. But there are some situations where we would not want that to happen. And you may have already seen a DNR form like this, which is an older form. And all this is just do not resuscitate. Whereas the most form talks about IV fluids, cardiac monitoring, antibiotics, things like that. It's much more complete. All right, next slide, please. And following that, I would like to share this video. If you would start it, and it has to go all the way to the very beginning, and we're just going to watch about 2 minutes of this. And if you take it back just a little bit more, and we don't have the volume.
I flunked the hospice program. Now, not many people can say that.
Doctors die differently than patients. She doesn't really know where she is, or she's not very with it right now.
I don't want to suffer like that. See, if every now and life machine, just let me go and get it over with.
You can't kill her trying to save her. If they have that conversation up front when things aren't so dire, it makes our job easier.
Presently, we're still a death-denying society.
I could just go to sleep one night and that would be it. Now, nobody gets that lucky all the time, and I don't know. I don't want to be in agony and pain if I don't have to.
Deceased, departed, bought the farm, passed away. No matter how you say it, it happens to all of us. More than 2.5 million people will die in the United States this year. The quality of those deaths is often affected by where they occur, whether at home surrounded by family and loved ones, or the intensive care unit hooked up to pulsing machines with blinking lights. The difference usually comes down to whether you passed on your dying wishes before passing on.
Thank you. Thank you. You can go to the next slide. Thank you so much. There is a longer, that was just a introduction segue into a longer program, which is very good. It is dramatic, and there's some images that might be hard to see, but it's reality, and we really need to focus on what real life is all about. So the first thing we need to do when somebody is elderly, needing attention, is to be involved. We need to talk with our loved ones about their health conditions. We need to go to doctor's visits with them, help them to make a list of questions to ask the doctor, ensure that they're eating well, getting their medications, and attending to all their personal needs, like personal hygiene. We need to be aware of subtle changes that we see. And we need to make sure that everybody that surrounds the person is involved. It is important to have discussions so we know what's going on. They might not even know the whole story. A lot of folks in the older generation just kind of go along with what the doctor tells them to do, and they don't ask questions, and they might not understand their health problems. They might not be active in the decision-making process, and that's very important. We need to be the ones that change that. It's important to know, of course, what problems you have and what medications you're on and what they are for. You can help them by being prepared to go to those doctor visits. When you go to their house, you might check in the refrigerator to see what do they have in there. What have they been eating? Does it look like it's healthy food, or are they just surviving on frozen dinners? I encourage you to be very observant of any changes. And if you see a change, immediately talk to the person who's is the number one caregiver for that person. And it's important to identify and talk with doctors early when we see any problems. So acting on those observations can make a big difference, and it might prevent a hospitalization. If all else fails and your loved one goes to the hospital, then what do you do next? And let's go to that next slide, please. So these are things that we need to be doing while folks are in the hospital. You need to do these things so you're knowledgeable about what is going on. What are the problems that they've found? How are you going to be helping to take care of them after the hospitalization on that homecoming? You need to be in attendance, talk with the doctors, sit with your loved one, offer assistance, help with their basic needs. In the last 2 years during COVID, hospital staff have been overloaded, and we have lost a lot of hospital staff. So they are going to be doing the tasks that are priorities. Putting on a call bell to ask for a drink of water when somebody could walk down the hall for their family member and get a drink of water is something you could do. But if the person needs to get up and go to the bathroom and they're a fall risk, that would be appropriate to go ahead and call someone. We do need to encourage their independence as much as we can, as long as they're safe. Immediately, the staff should be starting to talk about what to do when you go home. And that is very important, because from the day one, they are looking towards how can we get this person better to the point where we can get them home within a few days. And it's important to keep everyone else on the home care team involved and informed what's happening. All right, I'm ready for the next slide, please. All right, discharge plan. That is the plan of what's going to happen when the person goes home from the hospital. And of course, safety is a priority. Usually there'll be paperwork, and explicit instructions will be written out. So you have to have your discharge papers. You need to be meeting with the doctor, talking with the nurse, and getting all your questions answered while you're in the hospital to make things so you understand everything smoother when you come home from the hospital. When folks go home, it's important to know, are they going to be able to manage by themselves? If it looks they're going to be having difficulty, everyone needs to take a responsibility and be involved. So there should be like a team leader, and that team leader can organize the assistance and ask everyone else to be involved. It's important that the team is involved and not just all the responsibility on one person. Certainly, discharge planning is important to prevent complications and the possible return to the hospital, and that is definitely the last thing we want to happen. All right, next slide, please. So what I've been saying is that transition home is a fine coordinated effort. So you have to make sure you have the papers. You have to have the prescriptions. You may actually already have doctor's appointments that are set up. Most often not. They'll say, have an appointment in 2 weeks. So somebody might have to pick up the ball and make that appointment once the person comes home. Often there may be home health services, nursing services, physical therapy, occupational therapy, speech therapy that may be coming out. And you need to know who's going to do it and when they might be expected to visit. Also, folks might be ordered new equipment when they're leaving the hospital. A wheelchair, a walker, a hospital bed, oxygen, a nebulizer. It's very important to know what those things are and how to use them. And we can go to the next. So all of this is care coordination, and you're a big part of it. When we're doing this, we try to make it streamless, and so everything comes together and it's a smooth process. Some families are able to do this on their own without any outside assistance, but there are folks that can help. There are care managers like myself that can be involved. There's social workers, and those folks are in the hospital. You can be talking to them while you're in the hospital, but also there's folks on the outside, on the other side, in the home setting that you can ask questions. Many of the HMO Medicare plans, Advantage plans, offer care management services at no additional cost. And this is just a real gold mine, I think, for many patients. Also, the doctor's offices are now offering care management. So that's very nice because you're already acquainted with the staff at the doctor's office. Next slide, please. So the priorities on coming home, I've listed them here: safety, food, transportation, medications, appointments, and understanding the medical instructions. Any gap in any of these areas can set up a cascade of events that could lead to a rehospitalization. So as we've talked about before, safety is paramount. Do they need supervision? Is the home safe? Are there safety or fall hazards? Falls are one of the biggest reasons that older adults have to go to the hospital, because they've fallen and they've injured themselves. So the home setting is, it's very important for somebody to assess that environment. We've already talked a little bit about equipment. Do people know how to utilize the equipment? For example, oxygen might be new. And the people that provide the oxygen should be educating the patient and the family on how to utilize that. Nebulizer machine looks kind of intimidating for breathing treatments, but it's really easy to use. It's just a matter of being taught how to use it. We've already talked about food. Transportation is a big thing, why people don't get to their doctor's appointments. So first of all, is the person able to drive themselves? If not, who is going to take them to the doctor's appointments? If there's not somebody readily available to take them to appointments, there are other services. There are, of course, Uber and Lyft. Moses Cone does have a transportation phone line. Is your loved one able to go in the car without any equipment, or are they wheelchair, need a van to come with a lift, or are they bedbound and need a stretcher or ambulance transport? Those are all things to consider. Medications are extremely important, and this is also another reason why people may end up back in the hospital because of not having all their medicines. They may start taking the medicines that they took before the hospitalization and the new medicines. So we could have a duplication of medications. We could have the same medicine being taken, a 50 milligram dose and a 25 milligram dose. That is very important to allow your healthcare providers call and do the medication reconciliation or rechecking up on that medication list. Everybody that's going to call is going to want to go through that list. And I just ask everybody to be patient and go through that process, because sometimes on a medication reconciliation, that person might miss something. So it doesn't hurt to go through it a second or a third time. All right. It's very important to get to the doctor within 1 or 2 weeks after leaving the hospital. A lot of people say, well, I was just in the hospital. Didn't they take care of everything? Well, they did everything they can, but they are passing the baton on to the home care team and to the primary care provider. So the primary care provider needs to know what's happened during that hospitalization and how to care for you in the future. It's very important also to make sure that you understand all instructions. So there's never a silly question. Ask your questions. And if you have a question about a medicines, I'll just give you one example. Gee, doc, I don't understand. I got these pills for my hemorrhoids, but I can't swallow them. Well, that's because they are not to be swallowed. So something so seemingly so simple as that can really hinder someone's healing process. All right, let's go to the next slide. Preventing readmissions. This is what it's all about. We've been in the hospital, we've come home, we got to stay well, and the last thing we want to do to the hospital. Medicare monitors readmissions, and they penalize hospitals for readmissions. That kind of makes sense if it was for the same problem that you're going back to the hospital for, but that is not the case. You can be admitted for heart failure last week and fall and break a hip this week, and the hospital will still be penalized because it's a readmission within 30 days. So that 30-day period is very important. We need to do everything we can to avoid those complications and keep people from having to go back to the hospital. Okay. All right, ready for the next one? We already know that there's a lot of financial ramifications for going back a little. It hits us right in the pocketbook. It hits the insurance company, and it hits the hospital system. It also, there's an awful big emotional burden for the patient and family if they have to go back to the hospital. And that just, that over and over and over again scenario is just makes everybody weaker. And we don't like to see our loved ones going in and out of the hospital. When we start seeing that of the hospital, in and out of the hospital, it may be it's very difficult to prevent that from happening. And it might be because the person has a chronic illness and is actually approaching the end of life. So we need to be very vigilant of that. Next slide, please. I'd like to share a few Medicare statistics. That these are just really mind-boggling to me. There were 2,290,100 all-cause readmissions in 2018. Just about 17% in North Carolina. That's just hard to imagine. 17% of all hospitalizations, those people had to go back to the hospital. So, and the average cost of a readmission is $15,000. Now, I know everybody's mind is whirling around with those figures. Many of these trips are preventable, and even the initial hospitalizations may be preventable or even unnecessary. So who do you think is paying for this? We all are. This is coming out of our pockets, and we all need to step up and take responsibility for our health and for helping others stay well. Next slide, please. This is a wonderful tool that in my work, we use it, we give it to everybody that we work with. Know before you go. So I love diagrams because we have several of them that use this kind of stoplight directions. So green is usually good, you got to go. Yellow is caution, and red is stop. So when you're in relatively good health and you have a health issue, you're going to go to the doctor's office. You're going to call, make an appointment, and go to the doctor's office for your problem. This is the least expensive way for you to get that problem resolved. When you have a more urgent need, go to urgent. That might be you've fallen and you have sprained an ankle, or maybe you think you've broken a bone, but you don't need to go to that. You can go to urgent care and they can take care of you there. And that is the most economical way for you to take care of those type of things. We reserve going to the hospital for life-threatening problems. You're short of breath. You have chest pain. You've been in an accident. Those are obvious reasons why you need to go to the hospital. So that's something that I have to reinforce to a lot of folks, because there are some people that don't have a primary care provider and they use the emergency room as their primary care office. We really would like to redirect folks to get involved with their primary care provider. Next slide, please. I imagine a lot of you have seen or heard about the silver tsunami. Well, by 2050, there will be an estimated 85.7 million of us 65 and older. And that will be an increase from 54 million in 2019, just 3 years ago, or a 63% increase. So there's lots of us going to be there. It's so important for us to be proactive in taking care of ourselves and our loved ones. Next slide, please. So you might wonder, why are people going back to the hospital? What problems are we seeing in the hospital, or what are the common things that are difficult to manage that people feel like they have to go back to the hospital? So the first is septicemia and infection. The second, excuse me, diagnosis is congestive heart failure. Third is COPD, or chronic obstructive pulmonary disease. Fourth, pneumonia. And 5, acute and chronic renal failure. Now, I put a little asterisk beside heart failure, COPD, and acute and chronic renal failure. These are chronic illnesses. People are diagnosed with them, and they can live with these problems for years and years and years, and they can be medically managed. The better they're medically managed or self-managed by the patient and family, the longer a person can live with these problems. So it is, if you have these type of problems, it's very important to be vigilant and to notice if there's any subtle changes. And just like the stoplight, you're green, you're good. Yellow, caution, you're noticing symptoms. That's the time to call the doctor. Be seen by the doctor. Call early to avoid the complications and avoid going to the hospital. Do not hesitate to call your doctor's office. Even after hours, they have most offices have an answering service that will call you back, or you can listen to all of the recording when you call the doctor's office. And they usually say, call such and such number for the doctor on call. So you call that number. You can either leave a message or put in your phone number, and someone should call you back. That is a great way to get advice from a physician on what you should do about the problem that's going on. Also, I want to talk about, in looking at these diagnoses, people come home from the hospital and they'll look at their diagnosis problems on their discharge paper and say, I don't have congestive heart failure. I don't have kidney disease. And they very well may have had this problem for a while, but it's not really been discussed because it's been a milder stage of the disease. And it's quite shocking to a person to see chronic kidney disease on their diagnosis list. So I would like to just remind everybody that as we get older, our organs are getting older also. So our heart doesn't pump as well. It's a muscle. It gets flabby and just doesn't pump as well. The little valves in the heart can get stiff, just like a joint gets stiff. Those valves can get stiff, and it lets blood flow back and forth into each chamber. The kidneys, it's a natural aging process. The kidneys don't function as well. They don't filter out waste as well. And as we age, if we don't have any other problem going on, healthy people will actually reach a stage of chronic kidney disease stage 3. So it's the stage 4 and 5 that we are really worried about, especially with diabetics. So this is why I say it's so important to be knowledgeable about your medical problems. All right, we can go to the next one. This is a great pictorial of the frailty scale. My colleague and mentor, Steve Evans, shared this with me. He is a geriatrician and works with Health Team Advantage. And this is something that we look at and trying to determine how well a person might do once they go home from the hospital. So if you're fit, well, managing well, we really aren't too concerned. You probably can go home and manage very well yourself. But once you get to the vulnerable stage or mildly frail, etc., we are very concerned about the assistance you may need when you get home. So unrecognized frailty is often the culprit that lands us in the hospital. And this is one of the reasons that it's really necessary to see your doctor routinely and more often if you have a chronic illness. Family might not recognize subtle changes. Those that do see the changes should be alerting other family members and the doctor. And as you can imagine, the more frail we become, the more likely it is that we're going to be more prone or vulnerable to being going into the hospital. Sometimes frailty or memory problems are not recognized until a spouse is not around or passes away. And then people are surprised to find that the surviving spouse is not able to carry on and live independently. And it's because the two together have been able to support each other's shortcomings. Next slide, please. So, who do you think is to blame for readmissions? Who is responsible for readmissions? Everybody is. Every one of the people in the care team are responsible to help people stay out of the hospital. We all need to come together to make things run smoothly and avoid those readmissions. Hospital staff need to communicate clearly and about the patient's needs and the instructions. The patient needs to be active in the decision-making process and in learning what they need to be doing to help themselves. We have to encourage self-care and just generally being able to take care of yourself. Primary care providers need to see you and review what's happened during the hospitalization. Family and friends need to advocate for their loved ones and assist with ensuring that the discharge instructions are carried out. And specialists might need to be seen after the hospitalization for certain organ dysfunctions. All right, next slide. So what if you don't go home from the hospital because you're too deconditioned, too weak? Some people might need to go to rehab or rehabilitation or skilled nursing. You have to have a skilled need to go to rehab. It is not an automatic that you just go to skilled nursing after you get out of the hospital. You have to have a skilled need. That might be you have complex wound care. You need physical therapy, speech therapy, occupational therapy. And And you also, not only that, you have to have the potential to be able to benefit from those services. You can only making progress on established goals. So if you get to a point where you cannot achieve the next goal, then that's when the insurance is going to say, okay, we've done all that we can here, and now it's time to go home. So there is no guarantee of the amount of days that you can stay in a facility. All right, next slide, please. Okay, so if you aren't going to rehab and you need help, or you're coming out of rehab and you need help, how can we help you stay at home? And there are a number of things you can do. You can hire in-home caregivers, which that can be costly. You could move in with a family member. That probably works in about 5% of cases. Other family members have their own lives and just do not want to take on the responsibility for a loved one. Assisted living is an option, but it is very expensive to go to assisted living, and the majority of us would not be able to afford that choice. Also, you could apply for long-term care Medicaid for placement. Now, that is a complex process. It takes about 6 weeks or more to be for your application to go through to find out if you're eligible or not. You have to go to Department of Social Services and provide all the financial information. You cannot withhold anything. You can't keep anything secret. That little nest egg that everybody in the family knows about, but you don't want anybody else to know about. That has to be divulged. So the person's income or Social Security income would go to the cost of care in a facility, and then Medicaid would supplement the balance. And I'm sure you probably have had an opportunity maybe to talk with a social worker that deals with Medicaid. That would be a great talk all unto itself. All right, next slide. So there's other things that we can take advantage of. Other services, I've mentioned most of the services, but there's in-home care. I do want to talk about in hiring somebody to come into your home. You can, this is something that Medicare does not pay for. Now, they may pay for home health after hospital, for wound care, PT, maybe a bath aid a couple times a week. But they do not pay for somebody to come and sit with you. So you have to pay for that out of your pocket. This could cost $10 to $30 an hour, depending on the services needed and who you hire. You can find somebody through word of mouth, from friends, church. If you're lucky enough to have somebody with a good reputation, that is the most affordable way to get help. Medicaid beneficiaries can be eligible for an in-home aid through the CAP or Community Assistance Program. You can hire help through an agency. And the advantage of using an agency is that all of their employees have been vetted and are skilled, and they have reputations to uphold. They have the qualified staff, nurse assistants. Everybody is licensed. There's, they do have some people that are unlicensed as sitters, but they are not able to provide any medical care at all. Let's see. Throughout the pandemic, it's been really tough to get in-home care because people have not wanted to go into homes of people with COVID. Everybody has been afraid of COVID. Many caregivers have left the profession. And so it has been very difficult for agencies to provide all those services. A couple of the things that I like using, and I'm not getting any monetary compensation for this. There's a website called caring.com, and you can go there and you can say, I need a caregiver for this area, and these are the needs that the person has, and this is the amount of money that I want to pay. That service can send you the names of people, but you have to do the interviewing and checking on their references yourself. So you have to take on the responsibility for that. And there's another site you can go to called A Place for Mom. And they can be very instrumental in maybe helping you find a facility that is appropriate and desirable for your family. Next slide, please. Sometimes the family caregiver needs to return back to the routine, and then there is a dilemma. So adult daycare is also available. There are many sites in our area, and it's just like it says, just like child daycare, it's adult daycare. You can have one there. Some people have transportation, and they will pick them up. They usually offer a meal. They have activities. They do exercise programs, arts and crafts. The premier of an adult daycare is our PACE of the triad, and it is an all-inclusive program for the elderly. You have to be 35 years or older, reside in Guilford or Rockingham for the program here that is on Cone, what is that road? Cone Boulevard. You have to qualify under the requirements by the state for nursing home level. I don't know if I mentioned, they do also provide transportation. They can pick you up from your home and bring you there. They provide all medical care there at the facility. And the services that they offer are just wonderful. It's a wonderful facility itself. It's anybody that is thinking that might be appropriate for their loved one needs to tour that facility. It is just really very impressive. All right, next slide, please. So in this day and time, we have a lot of electronic gadgets that we can also use to help us. You see what I have on my wrist here. This is an Apple Watch that my son just sent me. And, because it has an emergency alert. Gee, thanks, Justin. I think my kids are in cahoots. So this watch I can push a button for an emergency alert. If I would fall, it can detect the fall, and it would call my loved ones or 911, whichever is set up, so I could get assistance. The watch can monitor my heartbeat, my rhythm, my oxygen. It's just amazing what these kind of gadgets can do. Of course, there's all kinds of desktops and other smaller computers. There are devices to help people, to alert people if somebody is getting out of the bed, if your loved one is high risk for fall and you need to get rest when you can, you need to go to bed and rest, but that alert would wake you up in the case that your loved one is getting out of bed. Also, there are wander guards, and GPS tracking. So if your loved one likes to get out and wander around, those are excellent choices for things like that. Let's go to the next slide. Home modifications, I think, are becoming more and more common because our generation is starting to get the picture that we need to do whatever we can to stay at home as long as possible. That is what everyone would like to do. It's probably not very likely as we get into our really aged years, like into our 90s, unless we have some assistance. But I've shown, you can see here, these chair lifts are not as expensive as you might think. If somebody has a two-story home, I'd certainly have somebody on one level. But if you meet a lot of resistance when you're trying to take care of your loved ones, as I'm sure you know. I love this little kitchen setup that is, so everything is accessible for this lady while she's sitting in her wheelchair. And this picture of the bathroom is great because you can see that commode has the bar so you can get up and down. The lavatory is cut away so you can get up to the lavatory in a wheelchair, and you can just wheel right into the shower. So those are just wonderful things. There's many services. We see a lot of advertisements on TV. Those folks that are advertising on TV are pretty pricey. But there are also community groups that provide some remodeling opportunities. Church groups might build a ramp. There is a service called Safe Living Solutions, Aging in Place, and my work group has worked a lot with that group, and they just do a wonderful job in trying to help people stay at home. Next slide, please. So after all that is done and said, caregivers are our most important asset. And thank you for everything that you do. It is just so wonderful that you give of yourself to help others. We know you're great at what you do, and we know that it's also, and so it's important for you to take care of yourself. You have to have a break away. So that's why I keep talking about the family care team. No one needs to take on all the responsibility themselves, especially in large families. You need to really ask for help. A lot of people are not going to volunteer. So you just have to say, I need help. You make a list. These are the things I need help with. Mom needs to go to the dentist on this day, the doctor on that day. She's got a hair appointment. And while you're doing that, I need to get my mani-pedi too. So you got to take care of you. All right. And I'm sorry, I didn't mention these other services. Wellsprings Solutions has caregiver support meetings twice a month, and the Piedmont Triad Regional Council on Aging offers the Family Caregiver Support Program, which is an excellent, provides counseling, teaching, tools. They also can connect you with some funds, maybe for some respite care, so you can go away and have some time to yourself. The last things that I just want us to consider is that and next slide, please, Ashlyn. As we age, the likelihood that we will have a chronic illness increases. The normal aging process of our organs can lead, for example, to heart and kidney failure. Increasing hospitalizations is a heralding sign that the end of life could be approaching. And one thing is certain, we will all perish. Planning for what is to come may mean the difference between total chaos and tranquility. And I would like to hand it over for questions now. You can show the next slide, please. All right. Are there questions from the chat?
So what would you recommend for families that are maybe, their loved one is really, really hesitant to have these conversations? What would be your recommendation for the best way to kind of begin that conversation and kind of getting their loved ones to understand the importance of why that, these documents and these things need to be put into place?
So if the family is not able to broach that topic, they don't feel comfortable with it, or they're just getting a stop, you can let the doctor know that this is something that you would really like, a discussion that you would like the patient to have with the doctor, because the doctor needs to explain what his thoughts are about the life trajectory. So with chronic illnesses, we may only expect a 5 years of our life to be lived. And so 5 years, you need to really plan on how you're going to use that time and to make the best of it. So get the doctors to talk about it. People like myself and other care managers, social workers are very skilled in talking about living wills and making your wishes known. Getting just the information. There's something called 5 wishes that's in very nice language that everybody can understand. And just going through the 5 wishes, it just all makes sense. So those are the things that I would suggest.
And once the documents are in place, what is your recommendation for the best place to store them, if an emergency were to come up?
Sure. So the documents need to be at home. They do not need to be in a lockbox. Now, perhaps the estate will might want to be in a safe place like that, but somebody needs to be able to have access to that. So your healthcare power of attorney and living will needs to be in your medical record with your primary care doctor, the hospital or specialist, especially if you have severe cardiac disease. The heart doctor needs to know what your wishes are. The person that's going to speak for you needs to have a copy. And this is one of the very sad things that I've seen many years ago when I worked in skilled nursing. Family members don't agree on decisions. And so if a person is not able to speak for themselves and they don't have a document, and they have a large family, somebody's going to say do everything. Somebody else is going to say don't do everything. Mom wouldn't want that. Well, mom would. And it can be a terrible thing for a family to go through. Families can be disrupted for the rest of their lives because of it, and certainly a parent would never want to have that happen. So, did I answer your question?
Yes, you did. I think all of the information that you have shared tonight is extremely helpful. And, I think it's just important for anyone to really realize the importance of being prepared. Nobody likes to have these conversations, but at the end of the day, if there was an emergency or some type of situation where you're, suddenly in a crisis, I think it's important to know kind of what your loved ones want, what's important to them, because you don't want to be stuck in that position of having to make a decision and then second guess, the decision that you made and was it the right one and what they wanted. So
Exactly.
I think that this information has been extremely helpful.
Ashlyn, would you show the next slide? It has my email on it. And I just would like to invite anyone that has a question or would like information. I would be glad to talk with them and provide that information. I can certainly send out the advanced directives. We can do those if the person is a patient at Cone Hospital and they would give me permission to access their medical record. We can do it in the medical record. So please, I invite any questions. As I said, no question is too silly. Thank you very much for having me. I really appreciate it.
Well, Carroll, thank you so much. And just as a reminder to everyone, you can continue to go back and view this presentation as well as many other past presentations and future presentations on the ACAP community website, but also the ACAP community YouTube channel. So be sure to check out those videos. There are a lot of amazing topics there and really expert speakers that can provide you with some very valuable information. So again, Carroll, thank you so much for sharing your expertise with us. Again, we hope that everyone will join us again in April for our next presentation, but also be sure to check out the ACAP community website to learn of other upcoming events as well. So we hope everyone has a great evening. Happy St. Patrick's Day, and we look forward to spending the next time with you in April. Thank you so much.